is Tuesday, February 3rd, 2026, and driving you through this edition are Angelina
Melvin Stewart.
and of course we have Wata Kamara here, George also taking us live through ELBC and LMTV Live. Well, however, we are joining us this morning, wherever you are joining us from, we'd like to say welcome. It's always good to be here with you. For this morning, we'd like to take a moment to send special greetings to the Minister of Health, Dr. Lewis and Poto, our able deputies, assistant ministers, and all of the staff at Ministry of Health. We'd like to say thanks in a special way for your continual commitment to shaping the health agenda of our country. This morning, we have invited in studio Mr. William Zeze, HIV testing and counseling officer, who is here this morning to talk us through STIs, sexually transmitted infections. We'll be talking more on that this morning with focus on syphilis and that of hepatitis B. So stick with us this morning as we take this very short break to be right back. Welcome back and thanks for rejoining us. We now join our guests in studio. But before joining our guests this morning, Melvin, good morning.
Good morning, Angel, and good morning, everybody. And let me say good morning specifically to the health workers of Liberia. Thank you for the work that you're doing. Remain committed and serve well.
Okay. Well, as we go along, Melvin, I know we will join the Ministry of Health official Facebook page to, provide some health updates from the page for our radio listeners. But now let's join our guests in studio. Good morning, Mr. Stephen.
Good morning. How are you doing?
Good to have you here.
Thank you.
Honor our invitation on a very short notice. Okay, so before we, dive into the discussion, let's first hear from you. Who is Mr. KK, professionally or family-wise? Give us a summary of what you have.
Well, I'm William Kwasize. I am a professional nurse, but I also have a postgraduate degree in sexual reproductive health and rights from Lund University in Sweden. And so, besides that, I'm married, 7 children. So, I've been working with the National AIDS Control Program for almost 7 years. So, it's a vast experience with HIV and sexually transmitted infections.
Okay, how has it been so far working for about 7 years with the National Procedure Program?
Well, I think I feel so proud and happy that at least I was able to enter the national program and contribute my services because at the time we took over the National AIDS Control Program, the testing rate was around 56, between 56 to 60%.
Okay,
Because we're talking about testing rate, we're talking about the number of people. We have the target, but the number we were reaching were around 56 to 60%. But now we have reached up to 86% of our target because our role is to identify people who are living with the disease, the HIV disease, link them to care and treatment. And the more you get on treatment and you are adhering to treatment, the possibility of transmitting infection to other people reduces. So that's the happiness we feel because our president has in some way identified people who are on treatment, who are adhering, who have reduced the chances of transmitting HIV to others.
Okay, I'd like to appreciate the National AIDS Commission for the work that you guys do. The last time that Safino was here giving us updates on the different interventions, especially when it comes to HIV, and then through his update, we realized that a lot of people are, adhering to the different measures that have been given, and that means that you guys are working a lot to legislate in that direction. But this morning we are focusing more on STIs. But before we go to the disease, the infections that we picked among those different infections, let's first give a general, you know, background of what the sexually transmitted infections are.
Well, when we say sexually transmitted infections, these are infections that people get through sexual contact with others. It could be vaginal, oral, or any sexual act. These infections are spread like that. Even though some are venereal,
Okay.
which means they can also be spread through the blood, but most often they are spread through sexual contact. And some of those diseases could be bacteria, they could be viruses, or they could be what we call parasites, but they are generally transmitted sexually.
Okay, so you say bacteria, you say
Viruses.
viruses.
So,
Are those names of sexual transmitted infections?
no, those are the type of organism. Those are the type of organism. For bacteria, you will have chlamydia, you will have gonorrhea, you will have syphilis. But then when you go out to viruses, you will have HIV, hepatitis B, hepatitis simplex, you will have human papilloma viruses. So I mean virus. So that's what we mean. And then the protozoa will be looking at the lice that could be lice that are spread through because they themselves also cause infection.
Okay.
So those are the category. But then we may further categorize those that can be curable and those that cannot be curable but are manageable.
Okay, so let's get into that. Those that can be curable and the ones that can be.
So those that can be curable, there are a lot of them, but I will give few examples. Chlamydia. In chlamydia, you'll see the person will have sometimes just hotness of the urine, or they may have something pinning them in the urine, just like something is biting them, or you may have gonorrhea where you may have a urethral discharge, or syphilis where you may have ulceration of the vulva area, or where the organism have entered. If it's entered on the tongue, you will have ulceration of the tongue. If it enter through the vagina, you will have ulceration in the vagina, or on the penis, you have ulceration.
What does it mean when we say ulceration?
Ulceration means soap. It causes soap. And that's what makes STI very important to HIV service delay. Because the HIV will enter the body on this ulceration. Because once the person who you are getting in contact with has the virus in his semen or in his fluid, and you have the ulceration and that fluid enters the ulceration, you are definitely prone to acquiring the HIV. So those will be few, and then we'll talk about the manageable. We have the HIV, hepatitis B, the simplex, the human papilloma virus. Those are infections that are considered incurable or manageable, but there are some there the human body can get rid of it. For example, hepatitis B. So we'll be looking at least let's look at the two before we look at syphilis and hepatitis. But then let me first talk about the general symptoms that these things will bring. You may have burning urine, or you may have painful urine. You may have itching around the genital or within the genital. Person just having itching, or you may have abnormal vaginal or urethral discharge. You're having pus, in common terms we say pus. You have the pus coming from somebody private parts, or you may have genital ulcers, which is the same thing as I'm talking about ulceration. You have sore around the genitalia, or you may have rashes. Sometimes you have these blisters around the mouth. Herpes simplex, you have the blister. Somebody say, oh, that fever blister, or they are sexually transmitted. If you have that, you kiss somebody, you are definitely transmitting that infection. And then the most important is lower abdominal pain, scrotal pain or lower abdominal pain. You have that in these six conditions getting worse. Because if the woman start having lower abdominal pain, it means the infection is
So
increased.
for our okay, everyone coming.
Oh.
Okay, for our own man there is the lower abdominal pain. What are you saying for them to understand?
We are saying stomach pain that is under your stomach, under your stomach. It's not the upper stomach, but the lower stomach, under your liver. You have a severe pain there, or sometimes the person is having the menstrual period is either dark or is offensive. Those type of things will happen when you have a lower abdominal pain.
Okay. So the symptoms go for all the STIs.
No, specific STIs have specific symptoms.
Okay.
So when we discussing each of these are just general one. When we discussing each of them, then we go more into what are the specific symptoms for that disease.
So, who are the most vulnerable carriers in all of these health conditions?
Well, I would say you say most carrier,
Yeah.
the sexually active people. Those are sexually active,
Yeah.
and are not using protection, they are not using condom, and they are infected, they will be the one carrying the virus or the bacteria. But if you are even a youth and you are using your protection, you are not infected, you are not a carrier. Those people who are having unprotected sex and infected, they are the one that are carrying it out to other people. We usually call them the spreader.
So that will bring me to the question in relation to hepatitis B, because yeah, we've heard a lot of information surrounding hepatitis B, how people calm down with hepatitis B. Somebody infested with the virus, and they came in contact with somebody who is not who doesn't have the virus sexually. They will be protected with condom, but bodily fluid, yeah, are they prone to getting? Yes.
Hepatitis B, despite being spread sexually, the bodily fluid also carry the virus. And the virus can live up to 7 days outside the human body. So if, for example, I took a shaver, I'm infected with the hepatitis, and I did my shaving with a razor blade and I got wounded and the fluid is on there and you took it and you also cut yourself with it. For the hepatitis, we are saying up to 7 days, which means the virus also can live outside the human body for a longer period of time. But some viruses don't do. But for hepatitis specifically, because you asked question on hepatitis, up to 7 days outside the human body, and it could be found on those things that people use. But logically, nobody uses razor blade from their friend. So the chances of transmission reduces. But in remote area where people don't have access, they are poor, they sharing these utensils, possibility exists, but minimum. Because currently we are not. Everybody, you use one razor blade, you throw it away. I brought this particular one out because people usually stress on that only hepatitis. But for other infection, immediately they get out of the body, they die. Because they used to live it in the body fluid. Once the body fluid get dry, they also die.
Okay. So we are already aware about how one can sometimes, come down with this hepatitis B. I don't know if you can just give a general idea of what hepatitis B actually is. If you are already with hepatitis B, and we go to the symptoms of hepatitis B.
Okay, hepatitis B is a liver infection. It's an infection of the liver. It's a virus that causes infection of the liver. And once it causes infection of the liver, if your body is not able to get rid of it, 95% of adults will be able to get rid of the virus once they get infected. But the other 5% may not be able to get rid of the virus and they may develop chronic hepatitis. And once they develop their chronic hepatitis, the possibility of them developing cancer of the liver, liver failure, a lot of other complications, sometimes because the liver is so hard, the blood is not passing through, and there's a reflux of blood to the kidney too may start having problem. And so those 5% are really prone to having serious complications, and some of them may end up dying. But also for children, they are having the worst because children mostly develop chronic hepatitis. If the virus is transmitted to you from your mother, to you, or you got infected when you were a child, the possibility for you developing chronic hepatitis is huge. And so that's why you see the ministry is concentrating more on children because of the impact on children. But for adults, we say, yeah, we'll give you 6 months. If we can get rid of it, then we'll see how we can put you on treatment that will help your immune system to get rid of the virus. But for children, we need to concentrate on children, looking at the mothers, treating the mother who is infected, and then giving boys vaccine to children, and also treating the sexual partner. Because even if you treat the woman, you identify the woman in pregnancy and you start treating her. In case the husband is infected and he's not been treated, you will continue to reinfect the woman.
Okay, so you made mention of 95% being able to get rid of the virus.
Yeah.
Can you talk about how?
Well, the immune system is like a defense for the body. When you're eating good food, you're taking care of yourself, your immune system is not broken down. You're not taking those drugs that can break down your immune system. Look, your immune system is able to fight the virus and get rid of it. Our immune, that's why we always say good nutrition, good nutrition, good nutrition. If you have good nutrition, of course, you should be able to fight. But if you are taking drug, you are taking liquor, alcohol, and that is also having problem with your liver. So your immune system may not be able to fight.
Okay. Yeah, so talking about taking alcohol or taking drugs.
And those drugs are those drugs that suppress your immune system.
Okay. So with that, I believe that would be some of the behavioral practices that could take into one coming down with the condition. So I don't know if you have more to add to that.
Well, there are a lot of other things that could happen with hepatitis. For example, you got infected and you are put on treatment. You are now adhering to your treatment because the treatment is actually to reduce the viral load so that the body can be able to fight. But even for HIV, that's what it does.
Okay.
The drug doesn't kill the virus, but it stops the virus from multiplying. And once the virus is not multiplying, the body itself will be able to fight and eliminate the virus. So if you went to the hospital, you were diagnosed, and then they pull you on the treatment, and you're not taking your treatment, of course, the virus will continue to multiply. And as it multiplies, it uses the liver to multiply. As it multiplies, then of course, your liver cells are being destroyed. Over time, you see somebody with very big abdomen, then you have this fluid inside ascites, but it's because the liver has failed.
Big abdomen for my Oma in the village.
Yeah, but for the Oma in the village where they say the person got
so
water in the stomach.
Okay.
They say so water in the stomach. So those are the issues that may come out. And usually in the interior, they will say, oh, when you get those kind of thing, you're not supposed to take medication from outside, you need country treatment.
Yeah.
And then they put in herbs, the herbs further destroy the liver.
Yeah, you see a lot of people using
So,
the ball medicine.
And go get tree back and say this is what that will kill you. This particular thing, they call usually our country boy put and call yellow jaundice. And say when you get jaundice, you can take country medicine. You don't take injection. You don't take the only medicine that can cure it is country medicine. But the country medicine destroys the liver. The dosages are not measured. the liver is already strewn with infection, and the liver is responsible to break down toxic material that enter the body. How can a sick person be able to fight? The liver is already strewn, infected with hepatitis, and you are asking it to break down those herbs that you have sent in to be able to work. You are only causing more damage.
So what are some of the preventive measures? Because somebody listening, maybe they have come down with this thing we're talking about, this hepatitis B, and they are still finding it difficult to get a way out. What can be done if somebody is entangled with this disease?
Okay, the first thing is we're talking about prevention. We're not talking about those infected. We're talking about management, but the prevention is for those who are not infected.
Yeah, not infected.
So the best thing is you need to use condom. You need to use condom when you're having sex. Number two, regular hospital visitation to screen yourself. If you are negative, number three, take your vaccine. Take your hepatitis vaccine. Once you take your hepatitis vaccine, when you reach your third dose, usually they say 2, 3, it's all right. When you reach your third dose, you are protected for life. But more people don't like the vaccine. Like me, I have been vaccinated.
And how often do you get vaccinated?
Usually you take the first dose after 6 months, and then after another year. Just within 1.5 years, 2 years, you get fully vaccinated.
Do we have them in country?
Currently, the ministry brought some before and people took it. And then the next one that happened is we are trying to bring it in because the hepatitis program we are going to start. You cannot tell somebody you are negative, pregnant woman, you are negative, and you don't provide it. So the ministry is thinking about bringing in vaccine to be able to cover those areas. Also, you can have a child born to a positive mother, and you say the child is negative, but the child should not get vaccinated. So they got the birth flu vaccine, which of course I think the ministry is working on it to bring it maybe within the next 3-4 months. Once the supply come in, the maternal elimination will be starting.
So Ms. Ozese, okay, we've got the understanding of those that are not infected. I mean, that are not infested with the virus, but so they are advised to take the vaccine. Now, those that
use condom.
Yeah, those that already have the sickness. Is there a possibility for their recovery?
Yeah.
And how does that work? I heard somebody from one of the villages in the western region have been living with this thing for over 7 months, and their stomach has already grown, and they're coming for late hour treatment. How?
First of all, when you are diagnosed, first of all, we say do your test. If you do your test according to the national policy now we have, the WHO is advising that we give 6 months because the person's body could eliminate the virus. After the 6 months, then of course there's medication here. There will be medication here. Then you can start the medication. And usually when you start the medication, you are hearing it strengthening your body because it stops the multiplication of the virus, and then the body will be able to eliminate it. For those who are coming in the chronic phases, like the one you're talking about, somebody from Western region who already have external abdomen, distended abdomen, or maybe having high liver, the first thing we tell you, come to the hospital. Let the doctor see you. Don't continue with your country medicine. Come to the doctor, will see you. They will find out what is the stage you are in, what can help you to be able to recover. It doesn't mean because you have reached that stage, you will die. If it's not cancer, if it's cancer, it will tell you, look, your condition has reached to this stage, it's cancerous. If it's not cancerous, it's just maybe the hardening. They will support you to see how they can reduce the multiplication of the virus, and then your body will begin to repair itself, and with support from the medication your healthcare worker will give you, you'll be able to recuperate. But those who have really advanced, a lot of them, with the country treatment, they end up dying. You can always see those that they carry, they say, oh, they carry them in a bush for yellow journeys. You never see them come back. It's not possible that your liver is already suffering and you are giving those toxic medication and you say the liver will be able to recover. It's not possible.
Okay, so in general, what I am understanding here, what is very important is that we try to practice early screening,
Early
early
screening,
detection,
early,
detection
yeah,
saves lives.
early detection and early treatment saves life.
Okay, but in a case where someone is not going for that screening, but we are talking about this condition today, and people are listening. Let's just get highlight what they should look out for to say, okay, I think what they are talking about, I'm experiencing similar thing I should want to the health facility to get screening and tested.
The first thing is you may start having abdominal pain, and the abdominal pain will be in the upper right quadrant. You may start having lower upper abdominal pain. You may start having fatigue. Fatigue means tiredness.
Okay.
You're just getting tired. You don't know what is happening to you, but you feel tired. You're having fever. Then at the time, you begin to have joint pain. Once you begin to have joint pain, it means that the bilirubin is included. There's something called bilirubin, which the urine, the kidney get rid of. The thing that can make our urine yellow, the kidney get rid of it. It means the number is getting too much in the body. And so for that reason, the joints are responding to it. And then the next one you may start having, you start having nausea and vomiting. Nausea may feeling like vomiting. And sometimes you vomit. Then from there you have weakness. You can be fatigued, but you're not weak. But when you're getting weak, it means you're not able to go anywhere. You're lying down. When they tell you do this, I'm not able. Do this, I don't able. But then later you start seeing the person continue to complain of the abdominal pain. Then you go to the hospital, they will do the test. And luckily for us, the test is happening in the country. And more will be coming. But the more that will be coming, first we'll focus on pregnant women, then general population. Because we are worried about the children. Maternal transmission, we want to reduce it to almost zero.
I think we will have to touch syphilis, right?
Of course.
But let me ask this question concerning this hepatitis B. Monrovia is not just Liberia.
Yeah.
Most of the times, people complain why government just focusing on Monrovia. All of the good things that come, everything can stay right here in Monrovia. Are there possibilities where people in the rural parts, after maybe they've come to JFK or other health facilities in Monrovia and they got their first, maybe their first screening and they went back, but still they're not feeling good? Are there possibilities from your end to ensure that you have some of these facilities, some of these medications or vaccines placed to those health centers in the rural parts?
Well, for our health system, we are not urban health system.
Okay.
We are national health system. So all of what we do is all over the country. We will not be screening pregnant women here, treating pregnant women here, and somebody is lying that way in Bojiken who is not being screened. No.
Yes.
It will be decentralized. The county health teams will take control, and we will be here at national level to support the county health to ensure that no child, no pregnant woman is left out. And we start rolling that to general population, make sure that no person is left out. This is not an urban health system. This is a national health system. And even when we did we'll be on the syphilis, we roll it out to the entire country, to all the health facilities that are delivering the services. Until we reach that, we have not done.
Oh, that's
Okay, so from hepatitis angle, hepatitis B, you do more with the liver, your healthy liver. So we're encouraging people to practice early screening, to be able to detect conditions early so that they stand a better chance to be, cured or treated. But let's move to syphilis, which is one of the conditions that we're talking about today.
The first thing is syphilis is one of the common sexually transmitted infections that we have here. Syphilis is it's a bacterial disease. It is transmitted also through sex. That's why we call it sexually transmitted infection. What it does is it increases your chance of acquiring first HIV. Because you see anything that causes in your private part increases your chance by 3 to 5 fold acquiring HIV. Besides that, syphilis can also be transmitted from the mother to the child, go through the placenta. And once it goes through the placenta barrier, syphilis causes a lot of damage to the pregnancy. You may have abortion, you may have stillbirth. If those two things don't happen and you are lucky, you have the child may be born with other malfunctions, either of the heart, either of the brain, either of the eyes. And then we say, no, the child was, the child the child, somebody wished this child. But syphilis caused a lot of damage. And actually, for the past 3 to 4 years, the program has been able to reach all levels of our country with syphilis screening and treatment. Because we don't want any child born to have a complication that they will not be able to handle. So we have done maternal screening for syphilis and HIV, which we'll talk about another day. But for syphilis, at the time we began, we were less than 15% covering. Less than 15% it was single test. But now, syphilis and HIV are almost at the same level of screening.
Okay, we will come down to the different interventions we carry out to, prevent people from coming down with syphilis. But let give them the idea of syphilis itself. I mean, which organ within the body system that syphilis actually affects.
When you get infected with syphilis, the first place is your private also. Once it enters your system, in fact, the soul was there like a few weeks, it will go away. And that's what fool people. Once the soul come, go away, I'm all right. No pain, no problem.
It started another journey.
Now, now it goes into the system, it goes to the secondary phase before it goes to the latent phase. Then in those phases, it begins to affect or begin to destroy, affect the womb. It may affect also your brain. Sometimes you see somebody who has been chronically infected with syphilis, they lost memory. If it's a child, you will see the child either the child is born, but you see the guy septal defect, which means in the heart, there's a defect in the heart is over pumping, the heart is not pushing the blood, or the child got blind, the child is born blind, or if they continue, they will be born blind. They will continue to get blind because of the syphilis. And then we say, no, this child is a witchcraft child. It's not a witchcraft child. It's a condition that was not. You see some people, their bone is soft. They are walking, but their bone is soft. What is that? It could be syphilis. Certain part of here is hard, but certain part is soft. You get even moving, bone should not be moving. Is the joint that's supposed to be moving. But you see that it destroys the bone.
This is a very severe epidemic. looking at our not on par with other countries like in Europe, where this whole syphilis thing that was is rampant. But looking at us as a country, you want to
Yeah, let me come in. Let me just make this clear.
Yeah.
Our syphilis program is ranked as one of the best now
in the world
in
West Africa.
In West Africa.
Okay.
We are one of the best.
Now I'm just
We
getting
have-
to know.
We have been able to reach where other countries have not reached.
Wow.
And we are taking the first decision again to introduce hepatitis, as I just told you. So we are taking, our health system is taking lead.
Where are you getting the motivation from?
Well, the motivation is actually the decision of the Ministry of Health to move forward. The decision of the Ministry of Health to feel that the health of the people is their primary responsibility. And so they must go for it. They must go to solve the problem. So the ministry is accredited. I mean, it's accredited with that. They think, some people they say, well, it's not my business. I'm in Monrovia. But for the minister to say, yes, I want this because I'm here for my people, speaking for the government, that is a big plus for the ministry. Our syphilis program, one of the best, was. We may even be, other countries may even be coming to ask us how we manage,
Look for the
how are
strategy.
we going. We may not be equivalent or in par with the Western world, because for them they have a stronger public health policy that if you have this infection, you are forced to show all your sexual partner, and they are forced to come for testing. We have not reached that. But for
Yeah.
case identification and management, when it comes to syphilis, we are one of the top in West Africa.
Enjoy.
Yeah. So have we touched on the symptoms of syphilis? Because I heard you mention a few of them.
Okay, for syphilis, the first thing you will see is you will see a white light, you will see a sore in your private part or where the bacteria enter. See a sore, and then you may say, well, it's nothing, man. After a week or so, it's gone away, but then you may begin to have fever. You will overlook it. It will go. You may have fatigue. You will overlook it. It will go. You may start having headache. I talk about it affect the brain. You may start having headache. I'm having headache. My headache doesn't go away. I'll be going to do it. If you overlook all of those, you will realize now that you see what light. So you see blackness, even in your palm, you see the black thing in your palm. Your palm is not like mine, where you have red, but you have small black thing
Okay.
in your palm. That's down, even on the skin. Those are all signs of syphilis. But people will take it and say, no, somebody that younger fool, somebody throw medicine on me and it will go away. That's teacher. But sometimes it doesn't go away. The chronic phases now, you start seeing that you start losing hair.
Oh.
You start losing hair. And you think, what is happening? You say, oh, maybe I'm getting bored. But you may not be getting bored because boldness is not in your family. You are losing hair.
Wow.
And then when you want to look, your bone easily break. Those are little phases. And a small thing, your bone will break. What is it happening? It's because the syphilis has gone into your system.
But how long can one live the ways it can be prevented is using condoms, early screenings, and others. And then I'm very sure once these conditions are sexually transmitted, condoms will always be one of the ways you can prevent it. But for syphilis, what are other ways it can be prevented apart from just using condom?
Well, somebody will say yes. The religious people will say sticking to one partner. But sticking to one partner that is infected will not make you not to have it. If you want to stick to one partner because you don't want sexually transmitted infection, the both partners must go to the hospital, have themselves screened, they are negative, and they can stick together. Now they will not get an infection. But sticking to one partner who is infected does not stop you from getting the infection. So sticking to one partner, or for the children, because you don't have the knowledge, like the music I was just playing, you don't have the knowledge of sex. Children getting involved in sex at early age, they don't know how to protect themselves. So with delaying sexual debut will also help until you can get the knowledge on how to protect yourself in sex. Because the first sexual intercourse, starting your first sex. Wait, don't rush. Sex will never end. You can have much, but have the better knowledge that will help you so that sex will not be destroying you, but will be satisfying you.
Do we need to know some of the treatments for this syphilis?
Well, I think yeah, it's good that you asked the question. Syphilis treatment is available, and sometimes it's just one injection. It's just one injection.
Throughout the life.
No, that is when you have an infection. Sometimes it's just one infection. Depending on the stage you are in the latent age, latent phase. It will take you maybe 3 to 4 injections, and then you get it out, or you can get reinfected if you don't protect yourself. What we say, we could not sit on public radio station and say this is the medicine. Go to see your health care worker at the health facility. And the best thing about it is syphilis treatment is free of charge in Liberia. It's free of charge. Except you don't go to the facility, and in fact the medicine stays here until it's just people are not going for testing besides the pregnant women.
Have you found out why people are backing off?
I'm not saying no, you are saying backing off. It means they were doing it before, then they went back. Okay. No, they are not backing off. But they have not even developed the habit.
No interest.
We the men, we are the problem.
Why
we are so busy. We are so busy that we don't even take the time, even 1 hour, to go to the hospital to check ourselves. The women, as long as they get pregnant, they go to the hospital, they will be checked. They will be screened. They will be treated. And so we men use that and say, as long as my wife is negative, I'm negative. No, status is not shared. Your wife will be negative, you are positive.
And you will take it right back to the woman.
You will take it right back to the woman. And that's why we say once the woman comes and she's positive, we want to. The best thing is when a woman comes in for ANC, let her bring the husband. Husband, just go to the hospital once or twice with your pregnant woman. Then go through the same screening she go through.
Okay, before we open the phone lines, all of these interventions that you highlighted when it comes to treating hepatitis out of syphilis, do they all fall under the triple elimination intervention that's recently launched?
Yeah. The triple elimination actually targets pregnant woman, their sexual partner, and the baby. But that's not the triple. The triple is HIV, syphilis, and hepatitis. Transmission to child should be stopped.
Okay.
And how can it be stopped? The first thing is maternal screening, which is the mother. The mother is positive, the mother must begin treatment immediately to ensure that the virus or the bacteria is not transmitted to the baby. If the woman is positive, because we don't want to continue to be reinfected, we need to screen the husband. If the husband is positive, we also treat the husband to ensure that the transmission to the mother stops. Because once the transmission is there, the risk is always there to transmit to the baby. And once the baby is born, also for syphilis, we treat. If the baby was treated a certain period before delivery, at least a month, the mother was treated a month before delivery, we don't worry about the baby. But if the mother was treated less than a month before the delivery, then of course we need to treat it. For hepatitis, we also, when we start, we have those chain of treatment lines that I talk about. For HIV, once the mother is taking the treatment, the chances for transmission to the baby reduces because of the issue we call U equal U. Once you cannot detect the virus in the blood, the chances for transmission reduces.
All right,
Okay.
let's take a few calls now.
Okay, so if you just join us here listening to Roadway to Health and our long program brought to you by the Ministry of Health, and we are interview this morning with Mr. Sise, HIV and counseling testing officer at the National AIDS Control Program of the Ministry of Health. To be a part of this discussion this morning, you can call us on 0880-514-096, 0880-514-096, 0775677376, 0775677376 are the numbers to call us this morning and be a part of this discussion. I mean, Melvin, I like the way Mr. Cisse really they provided the education on STIs this morning, because a lot of people wait until it is very late before presenting to the health facilities.
Of course.
Do you have a call?
Yes, we have somebody. Morning.
Yeah, good morning.
Morning, please go ahead.
Yeah, thank you for your time. I want to know which on the year they say our still get talking about which on the year is this weekend. So I want to know. Thank you.
Morning. Morning.
Remain close to the radio.
Please go ahead. Let's
Let's take this person. Good morning. I'm fine. Your name and where do you join us from? Okay. Oh, can you walk away from your radio so we can hear you better? Okay, go ahead. Go ahead.
No time. Just go ahead. No time.
Yeah, go ahead. Okay. Okay, we are very sorry to hear that, but if that's all we'll respond to your question. Let's take this person. Good morning.
Thank you for taking my call. It's Melvin K. I'm calling from District Number 1, Miami County. And thank you for having those your visitors over there in studio. I just want to know about syphilis and hepatitis. Can you get those things from the toilet too? And my other question is, we don't see a lot of billboards. Is there a possibility that you would have some billboards around the highways and places of common travel? Thank you for taking my call.
Okay, thank you very much.
Let's take the last person then. Yeah. Morning. Morning.
Good morning.
Morning.
Yeah, this is Mr. T.D. calling from Sophie. I want to know where this facility can be found to do your test.
Okay.
Thank you.
Hello?
This lone lady. Oh, I'm sorry. If you can call back, we can. I want also take this lady. That person the person is on.
Okay.
Yeah.
Just the lady who just called, you can call back. We will still take your call.
Yes. So, madam, if you are still listening, we can give you just 30 seconds to speak your mind.
Yes, you are
Please
the only
call
one
us.
we will
Yes.
call. I
I'm
don't
so
know if
sorry.
she's the one calling. Take this and see. Good morning. I'm fine. Let's hear you quickly. No time. Or can you walk away from
Enjoy. So let's just leave that caller. We don't have time.
okay.
Yeah.
Okay, let's start from the last one. The person is asking which facility can we go to have tested. For syphilis, you can have yourself tested anywhere pregnant woman is being tested. And that means almost all of the facilities that are delivering ANC services, you can have yourself tested. There are other facilities that are providing syphilis testing. There's a known syphilis test. And of course, you can go there to have yourself tested. But the issue about syphilis is we have now rolled it out to the general population.
Okay.
So if you go there, they will tell you, oh no, the test is for pregnant women and their husbands who are positive, the positive pregnant women and their husbands. But there are syphilis tests all over the other private and government hospitals that you can access and you show that you have a self test.
Yeah, somebody
talk about
when you came to Liberia.
Okay. Well, we don't have a research to tell us when you came to Liberia.
All right.
We have not done. We've been around for a very long time. Even maybe I would say because before even I was born, and we don't have a research to say this is the first case. This first case was identified in Liberia. This is when we got to know.
Yeah, so we are wrapping up the man was
there was somebody
about if we can get it from the toilet.
Yeah, somebody asked. The first thing is he asked whether we can put billboards around. Yes. In fact, the department that is responsible for that is the department that is having the program now. They will be responsible to print and also to see whether you can, for hepatitis, we say bodily fluid. If you have a toilet that you are not disinfecting, and somebody maybe put their semen there or maybe wasted bodily fluid there, then of course. But if you have a toilet that is being taken care of, there's no chance that you will get an infection from there.
Mr. The time is out.
Yeah.
I'll just give a very short parting comment and close the program.
The first thing I have to say is it's good to go and have your evaluation and have your test done.
Okay.
Take your medication as prescribed by your health worker.
Okay.
Alert medication, alert treatment, save life and save health complication.
Thank you.
Okay, so with that, this is how I would like to leave you on today's edition of the program Roadway Department. Thanks to our guest, Mr. Zize, for sharing such valuable insights this morning. We have been your hosts, Angelina and
Melvin Stewart.
George has been here, taking us through in LNTV. Until next Tuesday.
Wata Kamara.
Until next Tuesday, have a good day.